Welcome to the open lecture, Can nature really affect our health? It is divided into 3 parts, and now we have come to the part 2, prevention of diseases. My name is Peter Schantz and I'm professor at GIH in Stockholm, Sweden, and study how human movement, health and environment are related. Understanding the role of nature in this respect is important, and some examples of progress with regard to disease prevention will be presented in this lecture. The disposition. First, a summary of effects on well-being, then studies of disease prevention, thereafter pathways for reduced morbidity will be reflected upon, and finally, the WHO recommendations in this context will be stated. WHO defines health as a state of physical, mental and social well-being, and not merely the absence of disease or infirmity. Thus, these two aspects are health variables in their own right and can be independent of each other. Let me now summarize some aspects from my lecture regarding well-being. Green environments can induce mental and physical changes which lead to well-being. Now, these include different forms of mood enhancement, reduction in stress, pain and exertion, as well as restoration of mental energy. Now, this knowledge developed during the latter half of the 20th century. Thereafter, some researchers started to focus on new aspects within this field. They asked, is there a relation between nature and prevention of diseases? I will now walk you through some of the early historical steps in this research, and the primary research question became, is greenery in or close to residential settings related to prevention of diseases for those that live there? Residential greenery can be street trees, green inner yards, private gardens, parks and peri-urban as well as rural nature. The first studies were focused on the relation between self-reported levels of greenery and self-reported or objective measures of health. A fundamentally important step in this field came with the development of geographic information systems, which enable objective measures of green spaces. With that technique, one can geocode individual places of residence, spot them on satellite photos, and evaluate the amount of greenery around them. Between 2002 and 2009, studies using these different methods were published. They all point in the direction of that nature in residential settings is positively related to prevention of a number of diseases and some forms of premature mortality. Let me now thank Dr. Schoute-Rees, who provided the main part of this table. 4 examples of more important studies will be presented. First, 3 relational studies, and then 1 experimental study. And the first study relates to prevention of new diagnosis of diseases and its connection to greenery, residential greenery. It is called Morbidity is Related to a Green Living Environment. It's based on 350,000 Dutch adults, and the occurrence of new diagnoses were followed during 1 year. They were classified by physicians into 24 disease clusters at primary care units. Now, the proportion of green area was surveyed and the socioeconomy was used as background variables. In 15 of the 24 disease clusters, a lower degree of new diagnosed diseases was noted with greater proportion of greenery in the residential living environments. Here we can see the prevalence of new diagnoses per 1,000 individuals, with either very low or very high levels of greenery around the homes. Among the cardiovascular diagnoses, a significantly high level of coronary heart diseases was noted among individuals with little greenery around their homes. Corresponding examples were also noted in musculoskeletal, mental, respiratory, and here the abbreviation COPD stands for chronic obstructive pulmonary disease, neurological, digestive, and miscellaneous groups of diagnosis, and here the abbreviation MUPS stands for medically unexplained physical symptoms. The sum of all diagnoses in these extremes were 917 and 716, a difference of 28%. Now the number of diagnoses with significant difference, with different amount of residential greenery, was 678 versus 526, a difference of 152. That corresponds to a mean of 26% higher levels of diagnosis in the area with the lowest level of greenery, ranging between 18 to 44%. Those data will now be used to bridge over to the next study for looking at the prevalence in the cluster of mental diagnoses. Depression and anxiety disorders are among the clusters that, in relative terms, appear to be more affected by greenery, 33 and 44%, than the mean value of 26. Now this leads me to the next study. It deals with the prevention of psychiatric disorders. The title is Residential Green Space in Childhood is Associated with Low Risk of Psychiatric Disorders from Adolescence into Adulthood. Let us now read what the authors describe as the most important significant aspects of it. Growing up in an urban environment is associated with risk of developing psychiatric disorders, but the underlying mechanisms are unknown. Green space can provide mental health benefits and possibly lower risk of psychiatric disorders. This nationwide study, covering more than 900,000 people, shows that children who grew up with the lowest levels of green space had up to 55% higher risk of developing a psychiatric disorder, independent from effects of other known risk factors. Stronger association between cumulative green space and risk during childhood constitutes evidence that prolonged presence of green space is important. Our findings affirm that integrating natural environments into urban planning is a promising approach to improve mental health and reduce the rising global burden of psychiatric disorders. There are many values of this study. One is that they have furthered the understanding of these issues through studying different levels of urbanization. Here we see the results from the center of Copenhagen, the capital of Denmark. The x-axis stands for proportion of greenery during childhood, and the y-axis stands for the risk of psychiatric disorders later in life. As we can see here, the risk decreases with more greenery. Now the same applies within the suburbs of the capital, as well as in provincial city, a provincial town, and rural areas. Now to the study of reduction of health inequalities. And it's called Effect of Exposure to Natural Environments on Health Inequalities, an Observational Population Study. It is based on 40.8 million Britons whose medical records during 2001-5 provided data on premature mortality for reasons of circulatory diseases, lung cancer, self-destructive behavior, and all causes accumulated. Now, greenery was surveyed in this manner, and the private economy was used. Here will be presented the results from circulatory diseases and all causes, since they were significant. All participants were divided into 5 groups depending on level of greenery, and Group 1 to the left represents the least exposure to greenery, and Group 5 the highest exposure. Each of these 5 groups consisted of 8.2 million participants with various levels of income, and depending on that, they were divided into 4 groups. Income Group 1 represents the 25% highest levels of incomes. The premature mortality rate for that group was set to 1.0 and compared in relative terms with the other income groups. Based on this image, you can see that Group 2 had about 30% higher premature mortality, and Group 4, that is the one with the least economic conditions, they had more than 100% higher premature mortality. Now, let us see what is the situation in the group with the most greenery in the residential area. As you can see, the difference between the income groups are much smaller. And let us now look at the results for different types of causes. The same pattern appeared. Thus, greenery appeared to diminish inequalities in the premature mortality for both all different causes and in circulatory diseases. So one could say that greenery seems to moderate the relation between income and premature mortality, and moderate it in a positive way. The 4th study is experimental and deals with environmental effects on rumination. It is titled Nature Experience Reduces Rumination and Subgenual Prefrontal Cortex Activation. Let us read the author's declaration about the significance of it. More than 50% of people now live in urban areas. By 2050, this proportion will be 70%, and urbanization is associated with increased levels of mental illness, but it's not yet clear why. Through a control experiment, we investigated whether nature experience would influence rumination, and that stands for repetitive thought focused on negative aspects of the self, and that is a known risk factor for mental illness. Participants who went on a 90-minute walk through a natural environment reported lower levels of rumination and showed reduced neural activity in an area of the brain linked to risk for mental illness, compared with those who walked through an urban environment. Now, these results suggest that accessible natural areas may be vital for mental health in our rapidly urbanizing world. Now, here we see the area views over the paths that were walked. And here we see the same settings in views from the ground. Subjective ratings indicated lower levels of rumination after a walk in a green setting, whereas that was not the case in the other setting. And here is an image of the blood flow in parts of the brain coupled to rumination. And as we can see here, that blood flow was lowered in conjunction with the walk in the green setting, but not in the urban one. Now to the issues of explanatory pathways. A great scientific challenge is to study and understand mechanisms that can explain the positive relations between green environments and health. Two principally different pathways will be illuminated. One is a direct effect from greenery on disease prevention. The other is an indirect effect that is mediated via one or more factors before there is an influence on the morbidity. Relevant questions to ask are if, for example, the positive effects of nature on various aspects of well-being can have such an indirect effect on disease prevention. For example, stress. Stress can induce inflammatory processes in the body, which, due to their widespread effects, have been called the cause of causes in relation to these diseases. Now, if nature induces stress reduction, one can possibly see an effect in terms of reduction of inflammatory processes, and in that way a disease prevention. Another possible mediation effect is that green environments may stimulate to more physical activity. That will be elaborated on in part 3 of this lecture. Now, if you have an interest in furthering your understanding of these issues, I can recommend this review, which is published as open access. This leads me to the summary of this lecture. Overall, there are now many studies about greenery and prevention of diseases, and they point to clear and strong positive relations. In many ways, these relations, in terms of pathways, causal pathways, are enigmatic, but the evidence is now so strong that WHO recommends that apart from the value of direct contact with greenery in our housing environments, there is evidence for a need for small local green spaces very close where people live and spend their day, as well as large green spaces offering formal provisions such as playing fields and opportunities to experience contact with nature and relative solitude. Now, another recommendation from WHO is that each child should have access to green spaces for play and physical activity. There are many good examples in the world where these kind of recommendations are met, also in big cities. And recently, a beautiful book describing many such examples has been published by Routledge. It also provides further reasons for why green areas close to where we live are important. A chapter in that book deals with the same aspects as this lecture, and it can be freely downloadable via ResearchGate. For further studies of these matters, I can recommend the Oxford textbook of Nature and Public Health. Now we are coming closer to the end of this part of the lecture, and next part will deal with whether nature stimulates more physical activity and thereby can affect health positively. Finally, here you find my email address in case you have any questions regarding this lecture, and the web address is to our research group is also included. The next two images will present the references cited in this lecture. Now, before moving on to them, let me just say that I hope that you feel enriched and that you have enjoyed this short lecture. Feel free to share it with others. And finally, many thanks for your attention.